For over 50 years, Boulder Center for Orthopedics and Spine has been serving patients in Boulder, Broomfield, and the entire Front Range. As the region's most preferred orthopedic practice, they offer the latest in joint replacement and revision techniques in their state-of-the-art facilities. Their doctors are highly trained specialists focused on and dedicated to delivering orthopedic excellence. And we took a trip to their Boulder location, so take a look. Dr. Yura Pragada, Colorado, and Boulder particularly, such an active community. So what are some of the common foot and ankle injuries and issues that you see out here where folks do adopt this outdoorsy lifestyle?
Absolutely. So because people are so active, they get a lot of overuse type conditions, tendonitis, the arthritis, but sometimes you get injuries. People rupture their Achilles playing sports, pickleball, basketball, tennis, and hiking. It's really treacherous at times. There's a lot of uneven footing and different things that may sneak up on you. So I get fractures too. So people will fall, break their ankle. But the most common thing is people want to push themselves to the highest possible level. And because of that, sometimes our bodies can't keep up. So I'm here to help facilitate that and support that as best as I can.
Great. And you specialize in minimally invasive as well as modern surgical approaches. How do these types of procedures offer people the ability to stay mobile, to be able to keep up that active lifestyle?
Right. So back in the day, surgeries worked pretty well, but they were more conservative, meaning you were off your feet for longer, maybe on crutches for 3 months. And while people recovered, they weren't able to get back as quickly as they wanted to. So with modern techniques and modern rehab protocols, we can be more aggressive safely. Through the years of studying these different surgeries, we found that we can be more aggressive, getting people back to where they want to be much quicker. So instead of having 9 months to recover, we can do sometimes 3 months. And it's evolved very quickly because of that.
Okay. Ankle injuries, chronic foot problems, these can really slow people down. So what type of treatments or procedures are you using that is helping people to maybe not deal with long-term disabilities and other types of issues?
Right. So especially for chronic tendinopathies and chronic conditions, for the Achilles, things like that, we do minimally invasive Achilles rupture repairs. We do minimally invasive Achilles tendon debridements. For bunions, hammer toes, these are conditions that as we're active, stuck in these tiny shoes, our toes can do crazy things that we don't want them to do. So we do things now under tiny incisions. And these small incisions, while they're technically demanding, what they do is decrease your postoperative swelling, your postoperative pain, because you don't have these big incisions that you have to take time to heal. We keep things small. And that type of style of trying to decrease the incisions and making recovery quicker, I try to do that across the board for all my patients.
And for someone who is dealing with ongoing foot pain or maybe issues with their Achilles tendon, when is the time that they should see a specialist like yourself?
Mm-hmm. If you think about your foot before you go on a hike, that means it's on your mind and preventing you from doing things. So that's the point. I think you should start getting an evaluation, because just because you see someone like me or someone else in the community doesn't mean you're getting a surgery. It means we're at least starting a discussion about what condition this is, what we can do to prevent a surgery. Then we have that relationship established to where if it ever gets to that point where it escalates, you don't have to start from square one. We have a relationship, we have images, we have an exam, and then we can build from there.
Okay. Being a dancer previously in my former lifetime, bunions, hammer toes, those kinds of things can actually be a lot more common than people might expect. Are there modern techniques now that can help people resolve some of those issues?
Right. So what I touched on before, it's back in the day, we used to make big incisions to try to accomplish these corrections to straighten out a toe, straighten out bunions. And while the surgeries themselves, they did well, you're left with big scars, longer pain with postoperative rehab. And now we found that we can accomplish the same thing through tiny incisions, and that requires extra training to do and practice and experience. But once you get comfortable with it, what I've seen across the board is patients are having less pain, they're recovering quicker, they can walk on it right away. And these innovations that I can't take credit for, but I'm definitely using in my practice. That's what builds medicine and gets people back to where they want to be much quicker.
Fantastic. Thank you, doctor.
Yeah. Well, thanks for having me.
To learn more about Dr. Yira Pragada and his specialties, visit bouldercenter.com. That's also where you can find details about the orthopedic care services provided, like Mako Smart Robotics technology, MRI scans, orthobiologic injections, physical therapy practices, and more. Visit one of their Front Range locations in either Boulder or Broomfield, and to schedule an appointment, call 303-449-2730. Boulder Center sponsored this segment. Stay with us.